Hello everyone. I'm back with a new video. This time is about hypertension. So let's get started. All right, well, what is hypertension? So hypertension, in simple words, it's elevated blood pressure. Well, what is blood pressure? Well, blood pressure is the force that is exerted by the blood against the walls of a blood vessel. And so now there's different things that regulate blood pressure, and these could be either your heart rate, um, that it's basically controlled by your sympathetic nervous system. It could also be due to vasoconstriction or vasodilation of your blood vessels, but also fluid. And fluid is managed by antidiuretic hormones, the renin-angiotensin, and aldosterone cycle. And these are by your kidneys. So in other words, what I'm trying to say is that blood pressure is regulated not just by one thing. It's different things that we have to look at. And when we talk about the medications, and I'm going to do a different video about blood pressure medications, you're going to see that most of the medications affect either the vessels, the vessels in the sympathetic nervous system or the heart rate, or perhaps they're tackling on the kidney. Okay. So now there's different classifications of blood pressure, and this is the latest of the latest by the American Heart Association guidelines. Normal is less than 120 and less than 80. So if you have a blood pressure in between 125, 130 systolic, you're considered elevated blood pressure. Isn't that kind of weird, right? But very low numbers we're talking here. There's different stages of high blood pressure, like stage 1 and stage 2. Here are the numbers for you to basically write down. Okay, who's at risk for hypertension? Well, men above the age of 55, women above the age of 65, diet with excess fats and sodium. You also have your race. African Americans and Mexican Americans are higher risk. Diabetes, smoking. You have your family history. You have alcohol, obesity, sedentary lifestyles. Socioeconomic status sometimes come into play because people cannot afford perhaps, a good diet or whatnot, and stress. Now, some are modifiable and some are not modifiable. Like you cannot control your age, you cannot control your family history, you cannot control your race. So those you can't. It sometimes is hereditary, but you can definitely control your weight and what you eat, for example. How does it manifest? Well, really, hypertension doesn't really have um, a list of, oh, yeah, here are the symptoms of hypertension. No, most of the times it's asymptomatic. That is why it's called a silent killer. Usually people don't realize they have hypertension until something gets bad and you have other symptoms or damages other organs. However, the book does talk, and yes, we know that you can experience some fatigue, dizziness, palpitations, sometimes headaches. Some people say, oh, I know I have my blood pressure elevated because I have a headache. You can have angina or dyspnea. There is something called a white coat hypertension. And so, what that means is that patients experience a high blood pressure whenever they are in front of a doctor or they go to an appointment, a doctor's appointment. So just know that, you might see that. There are many complications that can surge from hypertension, coronary artery disease, and myocardial infarction, cardiomegaly, heart failure, stroke, arteriosclerosis, peripheral vascular disease, and chronic kidney disease. It can damage your kidneys as well. We really diagnose it by blood pressure measurements, or sometimes blood pressure measurements and Treatment of blood pressure, like medication. See how your blood pressure reacts once you take this med. Physical and history of the patient, those are usually sufficient to diagnose it. Treatment, they give you a little pill or your blood pressure medications. However, the physician might order sugar levels, urinalysis, a CBC in a basic metabolic panel, your cholesterol, your lipid panel, in an EKG to see perhaps what is the cause, what's leading or what led to the hypertension, or vice versa. Okay. Um, for example, diabetics usually have damage to the blood vessels, and that kind of links with hypertension. So if you have an elevated glucose and hypertension, then we know, okay, which one came first? Well, probably the diabetes. Sometimes it's a gain of which one comes first, but with these we can kind of see what other causes or what other issues are going on. What do we do once we know that an individual has hypertension? Well, we really need to educate them on modifying their lifestyle, and that involves managing their blood pressure with natural things as well as medication, control their cholesterol, lower that cholesterol, cut down on sugars, cut down on salt, exercise, eliminate the stress, eliminate smoking and alcohol, a diet that is low on sodium and lipids and high in protein, vegetables, etc. They recommend that people lose weight. They say that 1 kilogram equals 1 mmHg on their systolic blood pressure. And so imagine, for exercise, they recommend moderate intensity aerobic exercise, so at least 30 minutes for 5 days. So not just cruising and just, oh, I'm taking my time to walk, but something that elevates your heart. It could be swimming, it could be walking fast, it could be bicycle, hiking, dancing, you name it. Now, we also educate them on how to read the labels of their food. So you have no idea how many people get this wrong. They just look at the calories and they're like, oh, it's 100 calories, but they don't look at the servings. So they think it's the whole box of for 100 calories, and it's not. It's just maybe one cookie or two cookies, or one tortilla, two tortillas. Um, so they eat the whole box, and not realizing. They also look at for example, frozen meals. They're like, oh yeah, this is a diet frozen meal. Well, when they look at the label, it's 1,020 milligrams of sodium. So in order to be preserved, they load it with sodium. So you have to look at all that sodium, total fats and cholesterol, carbohydrates, and calories per serving. We also show them the DASH diet that basically says your bigger quantities come from vegetables and fruits, then your grains, whole grains, especially seafood and low fat dairy. Then you have your beans and sweets at the top, so minimal sweets. Um, and so, pretty much as a summary, we want to be able to recognize what are the symptoms or potential symptoms of hypertension, although not everybody experiences them. But really, the key here is to prevent it and prevent those modifiable risk factors. It is a disease that can be treated, can be reversed, but it's not only treated with medication. You have to include, diet, exercise, even emotional stress, limit alcohol, limit your smoking, and then, yes, combine it with the pharmacological therapy. A lot of people have hypertension, and really it leads to a lot of complications that, if damaged enough, they are irreversible. So I hope this was helpful as a review for hypertension, and I will record another video that talks about the hypertensive medications. I'll see you. Here are my references. The book, as always, and all images are taken from Google. See you in the next video. Bye bye.